Well, I'll go ahead and get us started with some announcements. I know there's a couple folks still hopping in, so we're glad to have everyone here. Welcome to this session of the 2024 Culture of Data Conference. I'm Julia Simhai. My pronouns are she, her, hers, and I'll be moderating this session. We also have Peggy Jarrett, who is managing the Zoom and making sure tech is running smoothly. Her name is COD Breakout Room 2. So if you need anything, send a chat and we'll make sure that we get that sorted for you. You're all muted now, but if you have a question during Q&A, you're welcome to unmute or to put things into the chat. There is time for Q&A at the end, so if you want to add things to the chat as we go, you can, but we'll come back to them at the end. And if you're comfortable doing so, we also encourage you to add your pronouns to your Zoom name. You can do that by going to your square on the screen and clicking the three dots that show up in the corner and selecting rename to be able to add that in there. This session today has been generously sponsored by Champ Software, so we thank them for their contribution to the conference and appreciate them supporting CPHA in this event. So what we have today is just one presentation during this session that will be about 25 minutes long. And then, like I mentioned, there's going to be Q&A for about 10 minutes afterward. Please stay with us for the whole thing and join us for what I think is going to be a really exciting session. I'm really looking forward to hearing ways that the internet is being used for good, aligning with our conference theme of data for good, since we know that the internet often is not such a great place. So good to hear a positive spin on it today. And our presenter is Zach Genio to present Leveraging Social Media Success with Online Campaigns about Stigmatized Topics. So I'll turn it over to you, Zach.
Awesome. Thank you so much, Julia. I really appreciate it. I'll start by sharing my screen, and I know it is the first breakout session in the morning. So if you're still drinking your coffee and all that good stuff, do what you got to do. I feel that. But I'm super excited to talk with you all today about my presentation. Again, it's Leveraging Social Media Success with Online Campaigns about Stigmatized Topics. I think it's a really important kind of topic for us to discuss when it comes to our modern day world. And so we'll just go right into it. If there's at any point you got to go do anything, you got to get up, go to the bathroom, get some water. We're all adults. Feel free to do whatever you got to do. So first and foremost, I'm super curious. I love doing what I call pack polls. I'm an NC State grad, go pack. We were in our, if you're a basketball person, we were in the, Final Four for both men and women's leagues, which is pretty awesome. Don't ask me how we did after that, but pack poll. So if y'all can just drop in the chat, I'm super curious. On a scale of 1 to 10, how confident are you when it comes to using social media for public health campaigns? And it can be whatever campaign aligns with your line of work, your agency, things like that. 2, love that. 3, okay, so we're not feeling the most confident. And for clarification as well, 1 is not confident, 10 is I'm the best in the world. I'm ready to become the newest TikTok star. Okay, cool. Yeah, we're not feeling great. And that's totally fair. That's totally valid. First and foremost, I think it's super nice to pull attention to the fact that a lot of people don't feel confident in this, and that's super fair and valid. And it's something that is so niche, so new, so different, right? A lot of us maybe are from the age in public health where there's a lot of flyering, a lot of in-person stuff, a lot of hard copy stuff. And so kind of this switch into social media, we thought we had a grip on it, and then TikTok comes out, and then new algorithm stuff comes out, and all of that. So hopefully my goal for everybody today is that by the end of today's session, we'll be able to have that confidence grow a little bit. Even if it's 1 point, even if it's a 1 to 2, I will be happy with that. All right. So for our agenda today, just to give a brief overview, I have 3 main points that I'm going to talk about. So the first and second point are kind of going to go hand in hand, but I'm going to discuss an online campaign about overdose prevention as a case study for a successful online intervention that showed high impact without garnering negative attention or backlash. This was a campaign that I ran for my agency and organization. So I'll talk about that campaign. And while we're talking about it, I'm also going to discuss and to help us understand the process of creating an online campaign to maximize impact and engagement of target audiences while minimizing negative engagement. So that's the big goal here, right? How do we do a campaign that gets our messages across, but helps us not reach the side of the internet or not get the engagement from people that are being the trolls, right? Are being the negative people, are saying hateful things, and maybe preventing our ability to have a better reach when it comes to social media. And then finally, at the end, there's kind of going to be a little bit of brainstorming part. I always love to have like at least a little bit of an open forum where we can talk about some different ideas or thoughts, or maybe even questions, even if it's just in the chat, just so that we can see what other people are thinking. Because I think that there's a lot of power in public health workers and people in the public health field to be able to kind of hear from each other and get ideas from each other. So that's our agenda. We're going to talk through this case study. We're going to talk through all things social media. And then at the end, hopefully we'll start to think about how it can apply to your work, to your line of work. So a little bit about me. I know I jumped right into the pack poll and the agenda, but my name is Zach. I use any pronouns. I am currently a program manager for a harm reduction program based in Denver, Colorado, as well as Summit County, Colorado. If you're familiar, I work for Mile High Behavioral Health Care. And so I'm very ingrained when it comes to harm reduction. That's kind of my niche of public health. I work within all things safer sex and safer drug use. That's kind of my bread and butter. I also am a Gen Z identifying person who was raised on the internet. So social media for me isn't the most scary thing in the world. It's something that I'm very used to. I understand the TikTok trends. I understand, Instagram, Facebook to an extent. Sometimes I'll be talking with my younger cousins and they'll say things and I'm like, I am the oldest person on earth. I don't know what you're saying. But for the most part, I think that I've got a pretty good understanding. So kind of between both of those, I wanted to hopefully show a little bit of authority when it comes to the subject of social media, and be able to kind of let y'all know that you're in good hands, right? We're going to get through this all together and find this journey. So as well, everything that we'll be talking about will be through the lens of harm reduction, but I will be broadening it to fit into kind of general ideas so that it can fit into any field of public health. So why does this matter, right? Like, why even put all this effort into social media when it is the most painful thing on earth? When you're looking at Facebook and you're having to deal with ads on Facebook and certain things get blocked because it's an election year and it's all this crazy stuff and it's just the most painful thing. Why does it matter? Something I say to my team and then really anybody that I talk to when it comes to public health is public health workers are now social media managers too. Like, unfortunately, that's the way it goes. Social media is one of the biggest tools for health promotion and health education. We live in a social media driven age. Most people get their information on social media. Most people are plugged in some way to a social media outlet. And so it's our job to adapt to those times and be able to figure out how can we leverage social media for our success, for the success of our interventions that we're doing. So as a result, that health promotion needs to exist online. When it comes to that, like that equity aspect, right? Like, how do we make public health more equitable? How do we really make sure that we're being intentional when it comes to achieving health equity, striving for more health equity, especially across marginalized populations? We know as public health officials that marginalized groups often have more barriers than the quote unquote majority groups to their counterparts when it comes to accessing care, resources, information. Social media, as much as it can be the most toxic place on earth, can also be really beneficial because you're able to reach people that you might not have ever reached before, right? If somebody is unable to travel to your agency's location, or if someone just has never heard of, for example, Narcan or overdose prevention or whatever it might be, you're able to reach people that you've never reached before through social media. And so social media can be a tool for health education that overcomes so many barriers, right? It can be this really amazing tool to help break down those barriers for marginalized communities that you might be trying to target and bring resources to and have that conversation with. And it might also be really great in being able to have conversations with people about stigmatized topics, right? As we'll talk about in a minute, there's a lot of social media campaigns that can happen that are around stigmatized issues, conversations, topics. And that doesn't mean that we don't do them, right? We know that in public health, life, behavioral health, whatever field you're in, we know that we need to talk about things in order to overcome any challenges that might be associated with them. So by leveraging social media, we can have those conversations with people that might not have the ability to have that conversation with us in person, right? In real life. However, when that information is surrounded by so much hate and reaches the wrong sides of the internet, it can do more harm than good, right? I think about, anything, if you're on an Instagram post and you see a really cute charcuterie board that someone's posted, and you're like, oh my God, this is so cute. I bet everyone else thinks this is cute. And you go to the comments and you see that it's just full of hate, and everyone's like, you're the worst charcuterie board maker ever. You should delete your account and never do this again. That can be really discouraging for me as an I'll say a novice charcuterie person. I put a couple cheeses from Trader Joe on a plate and I call it a day. That for me is discouraging. It tells me, oh, I don't want to do that because the charcuterie community is going to come for me. And so I think about that too. It's a silly example, but I think it sheds some important light because I think we've all seen that on topics that might be lighthearted where we've seen so much hate. Now add in an element, add in the layer of it being a very important topic, something about related to somebody's health, something about a stigmatized topic, something that someone might not even be having conversations with their close, communities about. And then now they're seeing online all of this hate, whether it be anonymous or, associated with other people. And so when people go and see those campaigns and they might be interested in trying to get those resources, but then they go to the comments and see all that hate, that could also become a barrier to them accessing care. And so I think it's really important for us to figure out not only how do we do this so that we can get that information out, but we need to do it in a strategic way to prevent anything that might become negative so that people aren't being turned off to your support, to your care, to whatever public health program you're doing. So it's really important. This presentation, again, hopefully my goal is to really give you all some good tools, understanding, and guidance to avoid the mistakes that our team has made several times to be able to maximize engagement and minimize hate. So our case study. So we're going to talk about a case study that our team did back in August of last year, August 2023, for Overdose Awareness Month. So we've done previous campaigns. We've done a previous harm reduction campaign and we've done a pride campaign before. And we received so much hate. We got good engagement. We got lots of clicks, all the good things that you would want, especially if you're spending so much money. But when we were looking at those posts for our Pride posts, we received some of the most nasty comments that we'd ever seen. Stuff of, you all are abominations, you're going to hell, you should all stop, I hope that you all get shot up. Some of the most foul things, right? And there's an element of safety, right? Of being able to respond, report, all that stuff. But also for myself as a queer person, I thought about our campaign and thought, if I saw an ad like this and went to the comments and saw this hate, I would not reach out to this organization. I wouldn't feel safe because all these people are attacking it. Or I would feel even more discouraged, more upset, and that would definitely make me feel worse, right? So we had that Pride campaign, and it was so upsetting that it didn't work out, that it reached the wrong sides of the internet. Then we also did another campaign, and it was a harm reduction campaign. So it was very radical and progressive, I would argue. I was talking a lot about fentanyl test strips, testing drugs, Narcan, which not everybody's the biggest fan of harm reduction. So we got, again, lots of hate. We got, if you use drugs, you deserve to die. Why are we wasting our money on these people? All that kind of stuff, right? The most stigmatizing language that, again, like acted as a barrier of really engaging like well with the communities we were targeting. So we wanted to do another overdose. We wanted to do another campaign because, again, we know the power of social media. So we wanted to do an overdose awareness campaign for the month of August. The big question was how, right? How do we do this without getting all this hate? Because unfortunately, the way social media campaigns work is, you've ever tried to do one or ever want to do one, especially on Facebook and Instagram, which I would argue is one of the best methods because so many people are on those, two platforms, is you can't target specific things. You can't be like, I want my ads to show up to gay people, right? To queer people, people in the LGBTQ community. It won't let you do that because it identifies it as a political group, which is a whole nother conversation. But with things like that, even like, someone that uses substances, like you can't target that. So you have to do these roundabout ways where it's like, I want people whose interests are brunch, or like, I want people whose interests are going to festivals, but that doesn't mean that you're going to get your target audience. So inevitably, right, you're going to get people that don't agree with that topic. So the question was, how do we do this while mitigating this type of hate? So our first steps that we needed to do was take a step back. Whenever we're making any type of social media campaign, we need to figure out three possible things. What are our goals? Who are we reaching, and what are the possible problems that might occur? So with our goals for our overdose awareness campaign, we wanted to increase traffic to a landing page that we had created about events that we were doing for Overdose Awareness Month, information on how to get naloxone, fentanyl test strip, things like that. That was kind of one of our main goals. We wanted people to just know that we are this resource, right? So it's driving people, the main KPI, the main key performance indicator is getting people to the landing page. But we know that kind of the bigger consequences of that and like effects of that is people learning more about Narcan, learning more about our events, learning more about us as a community resource. Who are we reaching? That was kind of the second thing. And I'll get in more depth about audiences and why selecting an audience is important. But when you're just trying to educate everyone, it's just gonna inevitably fail, right? We need to be specific in who we're targeting with campaigns because every population is different and have different needs and need different conversations, language, dialogue, even creative content, right? Something that works for the 18 to 25-year-olds is probably not going to work for our 55 and up category, right? We need to be cognizant of who we're targeting. Who are we trying to reach? And then what are the problems that might occur, right? With pride campaigns, we do them every year. And obviously, one of our number one problems that might occur is people coming in that are homophobic, transphobic, bigoted, and saying really hateful things. On the harm reduction overdose awareness side, the problems are running into people that believe that people who use drugs deserve to die, right? People that believe that this isn't worth, the effort, things like that. So identifying ahead of time as to the best of your ability. And sometimes you're not going to figure it out until you do the campaign the first time. And you're like, whoa, I didn't know people hated this aspect of people. I didn't know people were so evil. Um, that's the beauty of the internet. So then once you kind of figured out those first three questions, the next thing is, all right, how do we actually mitigate this hate that we could receive, these possible problems when it comes to special populations and topics? And so we're going to talk about how our team figured out a way to best mitigate this without changing or altering or lessening the engagement that we received from people that we wanted to engage with our content. So our audiences, when we sit down and we said, who do we want to reach? Our first thought was everybody. We want everyone to know about overdose prevention. We want everyone to carry Narcan. We want everyone to be educated. Cool, not going to work. love that we thought that, but we broke it down kind of into four main audiences. We have our first one on the left, audiences who know our program. These are the people that knew who we were. This is the people that maybe already carry Narcan, that have seen us at events, follow us. They're the ones that already have a lot of buy-in. Our second audience are the people who are maybe sympathetic to overdoses and harm reduction, but they're new to it, right? So maybe they have that compassion. They have maybe some experience of like overdose affecting their life, but maybe not in a super direct way that first audience is a lot more engaged. Maybe they have a foot on the fence. They've heard of Narcan, but they don't really know much about it. The third audience that we identified was new audiences who are currently in active use, who might need education on overdose and harm reduction. So kind of similar to the second audience, but a very different approach that would need to be taken. And then our fourth audience was new audience who are not sympathetic to overdoses and harm reduction or addiction. These are the people that think people that use drugs should die, right? That is the far extreme, especially when we look at our first audience of like they're the harm reductionists, they're the ones singing hell yeah, they're the ones that are supporting. So we have this broad range, and we had to sit down and realize, okay, we cannot address all of these because the ad that works for audiences who know our program will not work for the audiences that don't even are not even sympathetic. So our first step was selecting which ones do we want to hit. And our thought process was audiences who know our program is going to be an easy low-hanging fruit because they already are on board, right? It's more of a retargeting campaign that we'll talk about is how we wanted to get them. But the new audience who is more sympathetic, right, but has like one foot in, one foot out, that's an audience that we determined would be the best use of our resources, the best use of our effort and energy, and would also help ensure that we could be able to get conversions, right? We could get people to come to our landing page to learn more, the ones that kind of have a little bit of say in. So then we kind of determined, okay, we're not going to target specifically these other two audiences, but that doesn't mean that you just completely scrap them out. So notice I didn't put an X over them. I put my little thought bubble because we need to keep thinking about them in the back of our minds when it comes to our campaign. Because what happens if someone who's in active use sees our ad? right? What if we accidentally have stigmatizing language in there that works for our first two audiences, but is stigmatizing for that audience and active use? And same thing when it comes to that audience that's not sympathetic. We might have people who are not sympathetic and they might be viewing our content. How do we ensure and mitigate to make sure that they're not adding in any hate? So this is our campaign that we ran. We ran 3 sets of ads. Super cute, super pretty. I love these ads. I thought it was really cute. And all of these ads applied in different scenarios. And I'll talk about the full flow chart, but I wanted to give you all a little picture. So we've got this first set of ads. And these are kind of our very sympathetic, very digestible perspectives on overdose. It's the story of, it could be your mother. It's the story of, it could be, your loved one. It's that really leveraging empathy that necessarily isn't the most radical approach that a lot of harm reductionists take. And it's definitely more watered down, but it's something that, right, can be a very more, digestible ad to see. Our second one, these are a little bit more very much clutch your pearls on the nose. It's somebody actively smoking and actively snorting a line with our overdose can affect anybody stamp as well, right? So these ones definitely, right, you're going to see would only be able to be seen by certain communities, certain groups. And then our last one is just our regular program vibes or program ads, our Be the Vibe ads. And so those are kind of our just like generic ones that we utilize. So our theory was this. Okay, we can utilize some with our 2 different groups that we selected. We said, well, let's make 2 pathways. We can retarget the people that are already engaged, right? So it's just like continuing that engagement, continuing to push it. But then how can we leverage more sympathy for less engaged individuals and prevent that rage engagement? And so they got those 2 kind of plans got put into 2 categories. Our retargeting category, again, there's the people that already know about us, are already probably carrying Narcan, and then the perspective category. So the people that have that 1 foot in, 1 foot out. So we made a flow chart. Public health people love flow charts. And so our retargeting campaign, they immediately, if they had already been engaged with our stuff, if they have engaged with other things similarly, then Facebook gave them our ad set 2. Ad set 2 was those harm reduction ads, the ones that people's actively smoking, actively snorting, because those would be received a little bit better from them. Then if they engaged with that, if they liked it, commented, clicked on it, then they would get into our ad set 3, which was our general retarget, our just like Be the Vibe ads, just so that they remember our name, right? Our prospective people, these are the people that have that 1 foot in, 1 foot out. We hit them first with our sympathy ads. So they didn't see the harm reduction ads if they weren't already like following us, related to us, anything like that. What that does is it prevents more rage engagement because it's that sympathy ad. Because it's a lot harder when you're seeing an ad of like, it was my mother, and somebody being like, well, your mother's a piece of shit. Pardon my French. I'm waking us up this morning. It's a lot harder to write that hate comment versus the person actively smoking. It's a little bit easier to write a hate comment, right? It's more separated. So our thought process was kind of leveraging that sympathy and that empathy to make sure that we weren't going to get that type of rage from people, and then people that were actually interested wouldn't want to engage. So their flow, if they clicked on it, would go to our landing page so that they could learn a little bit more and decide, do I really want to engage with this? And then they would go into our retargeting line of ads campaign. So then they would get the harm reduction ads or the retarget ads or both, and then they would be able to continue to engage with that. So again, just for reference, that ad set 1 was our sympathy ads, ad set 2 was our harm reduction ads, ad set 3 was retargeting. So when you look back at our flow chart with the ads, this is what it looked like. So if you've already seen us before or something like that, then you went into the retargeting pathway, you saw our more, clutch your pearls ads, and you probably engaged with them and then saw our main program ads. Versus if you had 1 foot in, 1 foot out, and maybe you didn't even want to be it, then you just saw our general overdose awareness sympathy ads. So with that being said, our results. We had over 1 million impressions across our platforms, which was amazing. But the coolest data point, and it's the best data point ever because it's a big old 0, we had no negative comments on any post at any point. If anything, we actually had positive engagement, especially on that retargeting campaign side. So the ads of people in the harm reduction sense, actively smoking, actively snorting, and then our general Be the Vibe ads, we got so much positive comments. We got people saying, it's so important. I carry fentanyl test strips. I carry Narcan. And that for us was the gold star of we did a campaign 2 years ago and got so much hate. And we did a campaign this year and on the same platforms, same everything, but changed how we put people through flow. We changed some of our creative, and we not only didn't get any negative hate, but we got positive engagement. We increased our followers and awareness of the topic and our program. So why did this work? There's probably a million reasons, but here's why we think it worked based off of our kind of experimental design. It's most likely due to limiting the more progressive content from reaching less sympathetic audiences. So the less sympathetic person did not see the person actively smoking unless they engaged through the sympathetic route. And what that did was it ensured that if people were going to see those more progressive, more radical ads, then they were already kind of interested. Versus if they weren't interested, they didn't get put in that retargeting pathway. We also didn't spend resources on groups that were less likely to engage. We thought about like, do we try to target these rage communities? Do we try to target the people that are, you know, more averse to the content? And we decided no. We said we're going to focus on the people who we can kind of have that conversation with that are more open to it. And then finally, we also think that our landing page was really helpful, especially for that, sympathetic on the fence audience, because it provided a little bit of information for people to learn more, which I think was really a great tool to help ensure that if people were going into that pathway through the sympathetic route, then they were a little bit more educated and able to engage with those ads. Major takeaways. All right. This is like, if you're going to remember anything, take a screenshot with your mind, write the things down, remember one of these takeaways. Define your audience. It should never be everyone, right? If you think, well, everybody should get this information, that's probably true. And I probably agree with it, but we need to define our audience to one or two select audiences. Then we want to understand the motives and behaviors of our audiences. What do they want? What do they not want? What do they like? What do they not like? Think about how you can prevent certain audiences from engaging with content they might not be ready for, right? So if we're going to go for a more radical audience, how can we make sure that people that aren't ready to engage with that might accidentally don't? Blanket campaigns for marginalized populations or more stigmatized topics are difficult. It's going to be inevitable. If you try to do a pride campaign, you do a campaign about a marginalized group or stigmatized topic, and you have no main kind of safety nets, then it will be really difficult to prevent that hate and it really effectively engage those populations. So look at employing one of those flow maps, right? Having some strategies to help prevent people from seeing content that they might not want to see. And then lastly, we want to be ready to pivot and respond to delete and hate comments if needed, constantly reassessing if things are going well. If certain ads are consistently getting hate, take them off, delete them. Don't waste your money on them, right? Being able to adapt during the process. So I know that I'm at time right now. So just curious, drop in the chat. How confident are we a little bit more now? Hopefully we're feeling kind of good. And I know we didn't get time to really like brainstorm as a group, but if people want to, while we're asking questions, we've got about 10 minutes for that. And so if there aren't a lot of questions, then we can kind of go through some of my brainstorming thoughts. 3-ish. I'll take a 3-ish because this was a lot of content. This was some pretty high level social media stuff, and I recognize that. So I'm not expecting all of y'all to be ready again to go on to move to LA and start your TikTok career, but at least my goal is to show you that it can work. You can do a social media campaign on a stigmatized topic or for a marginalized population and have success. It's not all hate. It's not all awful, evil, all that stuff. So I'm going to stop sharing for right now so that y'all can see my beautiful face because I did my morning skincare routine. So I'm glowing. And then I think Julia and Penny are going to help with Q&A.
Yeah, so we've got about 10 minutes, like Zach said, for Q&A. So you're welcome to unmute and ask your question, or you can type it in the chat and we'll read it out. I'll start with the question while folks type or get ready to unmute. I'm just curious. Well, first, this was great, and congratulations on a campaign where you had 0 hate messages. That seems like a huge accomplishment. And I'm just curious how you selected the messages that were going to be in each of the 3 different ads that you had. Did you all work with a marketing firm of some kind, or how did you sort of calibrate to make sure that those were aligning with the different audiences you were hoping to reach.
Absolutely. Yeah, I think so. We do work with a marketing firm, and they've been really great in helping consult throughout this process. One of the best things that we did was something called buyer personas, which is in like the marketing world, who is buying my product and what do they want? What are their motives, their beliefs? What do they like, dislike? And we sat down with the audiences that we were kind of thinking about and thought about what do they like, what do they don't like. So we had a better idea of who it was rather than just generalizing or not even kind of digging deep. So one thing that was really beneficial was just taking that time to figure out, okay, if somebody is on the fence about Narcan, thinking about even our personal experiences before we entered kind of the harm reduction field, what type of stuff helped us become more interested in it? And so one of the things that we kind of realized was that sympathy, right? Understanding and connecting it to ourselves, our community was really beneficial in kind of having that next step. So utilizing our buyer personas, utilizing and understanding deeper of who we're targeting so that way we're able to figure out kind of what works. And so using your own experience, asking others, we would ask our friends, friends that maybe we forced to carry Narcan or do our interventions. I think we all as public health people have had our friends do certain things for us, as our guinea pigs. And so leveraging that, right? Focus groups, things like that.
All right, we do have a few coming in the chat. So one says, I'm not familiar with the backstage work of social media. How do you route certain
Yeah.
campaigns for specific audiences?
Totally. Yeah. So it's kind of icky and disgusting, to be fully honest, and kind of confusing. This is where getting that social media support from like a external marketing firm, people that have maybe that experience is really beneficial. It's not impossible, but basically when you're in Meta, which is the suite for Instagram and Facebook, you're able to create those kind of flow maps. So it's like this audience gets this ad, and if they interact with it, then they get put into this audience. So it's kind of that way, but it's definitely not the most intuitive process. So I would recommend reaching out to people who have that more explicit experience to be able to help support, because that helped us a lot in the beginning to being able to create those flow maps for future campaigns. Because once you do it once, you're good. And then I see the next one is how much feedback did we
Yep.
that we had from community and audience prior to launching? Did we co-create messages? So again, we our team works with people with lived experience. They're employed and paid within our team. We have advisory committees, so leveraging a lot of those types of groups that we use, as well as our own personal lives and anecdotes, as well as across our agency. So I think when it comes to campaigns, if you're working on a project and if you have people with that lived experience, they're the experts on their own lives. They're the experts on that subject in their own unique way. So definitely utilizing that while you're creating those messages is important.
Great. There's another one about how your audiences were identified on Facebook and Instagram. I don't know if you kind of already covered a little bit
Mhm.
of that. Anything you want to add?
Yeah, definitely. So, when you're doing campaigns that are like, we want to just target the people that already engage with our stuff and like bring them back, maybe, those are really easy because you can select like people that have previously engaged with our campaigns or that follow us or things like that. You can target people that follow similar accounts. That's one thing, but oftentimes it is a little bit of spaghetti at the wall and seeing what sticks, which I love that phrase, because there aren't specific things that you can target, right? You can target geographically, you can target age, you can target some other main kind of identity points, but for the most part, it is a bit of spaghetti at the wall. So again, thinking about when you're creating your campaigns, if this could see reach anybody, if it can hit me, my dad, and my grandpa, what's going to be something that could help maybe mitigate to prevent certain people that might not be ready to hear certain things or want to engage with certain things from engaging with it. So that's why we try that sympathetic route, even though we prefer to have a more radical progressive conversation about, overdose prevention, but we recognize not everybody's there for that. And so kind of making it into that digestible content helped as well for when you're doing that spaghetti at the wall.
That's great. Thank you. think we've covered all the ones in the chat. Are there more to add, or anyone want to unmute and ask? Okay, one just came in. For campaigns where you did get hate, how did you decide which comments to respond to and which to delete?
Totally. Yeah, I think I do our program does a lot of in-person outreach as well. And this is kind of the general rule of thumb that I always tell people when engaging with people, where they say something that might be problematic or might be stigmatizing, is you're your own expert on like what is truthful, what is somebody actually curious and just saying something wrong, and what is someone just being an asshole, right? And so somebody's comment of "you all should die," yeah, that's a pretty solid, they're just being an asshole. And so we can just delete that immediately, report them, block them from our content. Versus the person that says, I just, I don't understand, why do I need to carry Narcan, right? Then maybe that is something that you can respond to and educate and say, yeah, carrying Narcan is really important because ABCD, right? It's a little bit of kind of trusting your gut with it. And if when in doubt, you're like, I don't know if this person's being truthful or not, just delete it, because if it feels kind of weird for you, it might feel kind of weird for somebody else that's not involved with your agency. That might prevent them from kind of engaging with that content. So definitely we would get a lot of hate just if that content reached certain platforms and people.
Great. Another one came in around, do you know how many people from the sympathetic route ended up following your work or subscribing for emails?
Mm-hmm. Yeah, unfortunately, we don't have that data. So that's one thing with social media is sometimes getting the data about what worked and what didn't is really hard. You have to go in roundabout ways. And a lot of the times it's a bit of like, we just know overall impressions. We know the overall amount of people that clicked on ads, but we don't necessarily have all of the numbers of people that went through certain campaigns. So unfortunately, we don't have that data. But kind of using those different transitive properties and kind of deducing through different strategies, we know that because we had a higher number of people in a retargeting campaign, we know that people must have come from that prospective campaign as well.
Yeah, that makes sense. I think that also speaks a little bit to early on when you talked about how you really should identify what your goals are. And sometimes a goal of a campaign might be like add all these subscribers but that
Mm-hmm.
wasn't necessarily what you were driving for here. And so it might be
Mm-hmm.
nice if you got them, but you know, focusing on the other aspects is still a success.
Exactly. Since we were really wanting that landing page to be one of the big hitters, we got a lot of views on that landing page. And knowing that the people from the sympathetic route were going to that landing page, it helped us understand that, okay, there are a lot of people going through that. But because we didn't, get like subscriptions and things like that, we weren't able to do it.
Great. Well, we got one last one in the chat. What's your next campaign going to be about? Just curious.
We are doing a pride campaign. So we're mainly a queer organization and we do a lot of stuff for queer and trans communities. So our overdose awareness campaign was August 2023. Our pride was June 2023. And that's where we got, again, lots of hate. So this will be our first pride campaign with now this new strategy that we learned from August to employ. So hopefully, fingers crossed, because pride campaigns get oodles of hate. Yeah, if you want to see how bad it is, just check out within our agency, we have the Transgender Center of the Rockies, and their campaigns always get just awful hate. People are bad people. So hopefully, fingers crossed that this strategy will work within another context. So we're excited about that, and hopefully, who knows, in another year, I'll be able to update y'all with more success.
Great. Well, thank you. We wish you luck with that and be interested to see how it goes. I will get us wrapped up here. Thank you again, everyone, for attending this session and engaging in the Q&A. Couple announcements before you head out. The slides for this are posted on Sketch, so if you want to go back and review them, you can find them there. You will receive a conference evaluation form after the conference ends, so please make sure you fill that out. Even if you only attend a portion of the conference, it's really helpful for the planning committee to get your feedback. And there's a raffle for two $50 gift cards for anyone who fills that out within the next 2 weeks. Now we have a break for lunch and give you time to get up from your computer and stretch. There is a recorded walk and talk session. If you want to listen, it's an audio only session like a podcast. The one for this break is titled Not Just a Seat at the Table, a more equitable approach to community health assessments. And the next live sessions will begin at 12:30. That's another concurrent breakout, so you have a few options to choose from, and you can look on the Schedule website to determine which one you want to attend. Thank you, everyone, and thanks again, Zach, for a great presentation, and we will see you again later today.
Thanks so much, Julia. I really appreciate this.
Of course, thanks.